So if you're here, I'm guessing it's because you love someone who's just trapped. Trapped by this constant nagging worry about their health. You see how much it hurts them, you feel their fear right along with them, and you've probably felt totally powerless to do anything about it. Well, today, we're going to change that. Think of this as your guide, your playbook, for really supporting them, okay? Let's get right into it. We have to start with this quote because it's everything. It is the most critical mindset shift you can possibly make. The panic, the racing heart, the absolute terror they feel, that is 100% real. So to offer any kind of meaningful support, we've got to start by acknowledging their reality. This isn't about arguing over symptoms. It's about connecting with that very real distress. Does this sound familiar? Your loved one comes to you with a terrifying health worry. You rush in, you try to reassure them, and for a brief moment, there's calm, but then, an hour later, maybe the next day, the cycle kicks off all over again. A new symptom, or maybe the same old fear, comes roaring back. It's this exhausting, frustrating loop that can just leave you feeling like you're spinning your wheels. And look at this list. If you're nodding along to any of these, just know you are not alone in this. Not at all. From the endless doctor's appointments that lead nowhere, to the constant arguments, to that awful feeling that maybe you're even enabling the fear, and, watching them go down that online symptom checker rabbit hole, it is just brutal. Of course you feel emotionally exhausted. That feeling is completely valid. So the big question is, how do we finally break that cycle? Well, here's our roadmap for today. First, we're going to understand the mechanics of the trap itself. Then, we'll get into some really powerful, practical tools. Rewriting how you talk about this stuff, learning how to support the person without accidentally feeding the anxiety, gently guiding them towards getting professional help, and finally, and this is so important, taking care of yourself through all of this. All right, let's start with section 1, the health anxiety trap. Because, before we can change our approach, we really need to get what's actually happening under the hood. This isn't just someone worrying too much. This is a recognized and, thankfully, a treatable condition. The clinical term for this is illness anxiety disorder, or IAD. You might have heard the older term hypochondriasis, but that name's been updated to really focus on the genuine anxiety that's at the core of it. The key here is excessive worry that just keeps going, even when all the medical tests come back clear. So they might feel something totally normal, like their stomach gurgling, and their brain interprets it as undeniable proof of a catastrophic illness. And this is the engine driving the whole thing. It is a vicious feedback loop. It starts with something completely normal, but their brain immediately jumps to the worst possible case scenario, and that thought triggers real intense anxiety. So to get rid of that awful feeling, they seek reassurance from you, from Google, from a doctor. And for a moment, it works. They get temporary relief. But here's the trap. That relief teaches the brain that seeking reassurance is the answer. It actually reinforces the behavior, making the cycle repeat, often even stronger the next time around. So let's move on to section 2. Because once you understand that loop, you suddenly have the power to step out of it. And the single most effective tool you have to do that, it's your own communication. Okay, this is so crucial. Stop trying to disprove the fear and start validating the feeling. Saying it's all in your head, even if it feels true, is just so emotionally dismissive. It tells them their suffering isn't legitimate. But saying, I can see how scared you are right now, well, that connects with their emotional reality, without you having to agree with the catastrophic thought. You're siding with the person, not with the anxiety. This is the same idea, just a different flavor. Trying to use logic like, but the doctor said you're fine, is like trying to argue with a hurricane. Anxiety is not rational. But an empathetic response, something like, I know how awful this uncertainty must feel, that acknowledges the real pain they're in. It builds a bridge of trust and keeps those lines of communication open. And this is probably the hardest shift to make. Our gut instinct is to just give them the reassurance they're begging for. But making promises you can't possibly keep, like, I promise you're okay, that's just feeding the feedback loop. Wise assurance, on the other hand, changes the goal completely. Instead of trying to get rid of the imagined illness, you offer to team up against the very real anxiety. Let's focus on coping with this intense anxiety together. That reframes the problem and empowers both of you. Okay, on to section 3. Supporting, not enabling. This is where we take those new communication skills and put them into action. It's really about that delicate dance of being there for the person you love, while at the same time refusing to play a role in the patterns of their anxiety. First off, it's pretty helpful to know that IAD can show up in two main ways. You've got the care-seeking type, who is constantly at the doctor's office, always asking for more tests. And then you have the care-avoidant type, who is so terrified of what a doctor might find that they avoid medical care at all costs. It's also really common for someone to kind of bounce between these two. Knowing their pattern can help you figure out how to best support them. So, what does a healthy boundary actually look like? Well, it's got to be clear, consistent, and, this is key, delivered with love. Maybe you agree on a worry window, 15 minutes a day to talk about health fears, but outside of that time, you gently change the subject. You can also refuse to participate in compulsive behaviors, like checking a mole on their back for the 10th time. And the delivery is everything. Something like, I love you, and because I care about you so much, I can't do this with you anymore. I can see it only makes the anxiety stronger in the long run. Which leads us perfectly into Section 4, opening the door to help. Because at the end of the day, IAD responds best to professional treatment, things like cognitive behavioral therapy. But bringing up the idea of therapy, that requires a really gentle and strategic approach. Here's a simple, super effective way to have that talk. 1, timing is everything. Find a calm moment, not when things are already heated. 2, use I statements. Focus on your concern, like, I'm worried about how much stress this is causing you. 3, and this is critical, frame therapy as a tool to manage the anxiety and the stress. You're not saying they're making it up. You're saying, I see you're suffering, and here's something that could help. And 4, offer real, practical support. Hey, I can help you look for a therapist, or I'll go with you to the first appointment if you want. Now, once they do agree to get help, you can be an incredibly powerful ally in their treatment. With their full permission, of course, you can offer what's called collateral history to their doctor or therapist. This is not about tattling. It's about sharing your observations, the patterns you've seen in their behavior and anxiety, which can give the professional a much clearer, more complete picture of what's really going on. And now we've come to our final section, and I promise you, it is every bit as important as all the others, caring for the carer. The emotional weight of supporting someone with IAD is just immense, and we absolutely have to talk about it. Living with this kind of intense health anxiety, it affects the entire family. It's not just their problem. It can lead to your own emotional burnout, it can put a huge strain on your relationship, it can cause financial stress from all the medical bills, it can even make you feel isolated from your friends. Seeing it all laid out like this is a validation of your struggle. What you're going through is real and it matters. You've heard that saying on airplanes, right? Put your own oxygen mask on first. Well, it has never been more true. You just cannot pour from an empty cup. That means finding your own support, whether it's friends or even your own therapist. It means carving out time for things that recharge you. And please, please hear this. You are not responsible for curing their anxiety. Your role is to support, not to fix. And it is absolutely okay to feel frustrated or angry or just plain exhausted. Let yourself feel those things without piling on any guilt. So if you take just one thing away from our time together today, let it be this. Your job is to separate the person you love from the disorder that's making them suffer. You pour all your love, compassion, and energy into supporting the person while you build firm, loving boundaries against the patterns of the anxiety. And that leaves us with one last question to carry with you. A little challenge. In your very next conversation, what is one small thing you can do to shift gears, to move away from automatically reassuring the fear, and instead consciously choose to validate the person who is feeling it? Because that single intentional shift, that's it. That's where a new, more hopeful path begins for both of you.